Another question that is coming up a lot is about children. What do we know about children as in terms of the illness that they get around COVID-19, and how important are they as potential vectors for other people in terms of transmitting the virus to other people? So what we've seen pretty ubiquitously throughout the planet in communities that have had widespread transmission of COVID-19 is that children tend to have very mild symptoms, if at all, and very few children proportionally wind up getting sick with COVID-19. Some of the data we're seeing out of China and South Korea and elsewhere indicate that really a minority of patients, probably on the order of 1% to 2%, have been in children. And so that's good news for parents and for kids. I will underscore that there are some kids, though, who do wind up developing more serious disease and require hospitalization. And the children who are at increased risk for more serious disease are children who have underlying medical conditions, particularly if they're more severe, including heart and lung conditions and diabetes. But one thing I really want to underscore to parents and to people in the community and to adolescents who are hearing this is that we really need to practice social distancing with our children, because even though a child may have mild symptoms or may not even be symptomatic at all but be infected with the virus that causes COVID-19, they can still potentially transmit that virus to other people, including their friends, who, when they get together, if they're not staying at least 6 feet away from each other and they're not washing their hands frequently, then they can become infected and then spread the virus to their families, and then the path of viral spreading continues. And so we really want parents to be vigilant about maintaining that 6-foot distance between their kids and their playmates. And also want to just really encourage adolescents and young adults to please adhere to those recommendations. And one last note on children, I think it's very important to underscore that if other people in your home are at particularly high risks for severe illness from COVID-19, please consider extra precautions to separate your child from those individuals. For example, if you're unable to stay home with your child during school dismissal, carefully consider who might be the best person to provide child care. If someone at higher risk for COVID-19 will be providing care, limit your child's contact with those people. Please consider postponing visits or trips to see older family members and grandparents, and use the telephone or electronic means to communicate.